Okay, so this is a chapter review for chapter 17 for your test tomorrow. I'm starting on page 427. So just know the difference between whenever it's starting with the overview of patient accounting. What is the difference between patient account and account receivable? And there are AR stands for account receivable. Flipping over to the next page, your account receivable transaction. You do need to know all of those definitions under that section, under the account balance. What is an AR transaction? That is accounts receivable. And be familiar with, what does charge mean? What is debit, credit, payment, adjustment? Just be familiar with what those terms stand for. On the next page, most of your adjustments, starting about the second paragraph, most of your adjustments are credits. These are subtracted from the account balance, and then sometimes a write-off or a contractual allowance is the other name for it. So what we're discussing is things that if you work at the front of a medical clinic or a medical office, especially if you were in a managing position, these are things that you need to be familiar with. We will get into coding and billing in our next couple of chapters, but you do need to know if you were starting the day out or if you are having to close the day out of your clinic, what does all of these mean? And you will need to know how to do them if you choose to work in the front area of your clinic. You may not choose to work in the front area of your clinic, but let's say, for example, if you're working for Dr. Jones and he's on vacation for the week and the medical assistant that was working the front desk has called in sick, you may be pulled from your clinical position to work in the clerical position. So you still need to be familiar with what these things mean and how to do them if you're ever asked to do them. So just be familiar with their names, their titles, and what they stand for. Your day sheet. Your day sheet is a running total of all patient account transactions. So that's going to be all of your visits for the day, what was paid, what co-payments you received, and all of that information is going to be on there. Your day sheet is reconciled daily. On the next page, we'll get into something a little different, but your day sheet is the only one that will need to be done every day. That is daily. So flipping on over, on page 30, at the bottom of the page, where it says patient billing record. What is the information that is contained on the patient billing record? Why should this be important? Why would the employer need to be listed on your patient billing record? So that's just something to keep in mind or to think about. An example would be maybe they're having a difficult time reaching that patient. If that patient's employer is listed on the chart under the billing record, your manager or the person handling your accounts receivable can make contact with that patient employer to see if they're still employed there. So let's say, for example, if they're billing and their claim keeps getting denied or something is going wrong, their insurance may no longer be effective, and it may be because they have been terminated from their current position where they work. So that would be a reason to have the employer listed on your patient information. The patient ledger is a chronological record of the charges, adjustments, payments, and current balance for a specific patient. What is the difference between a patient ledger and a ledger card. On the next page, for your account receivable system, your patient financial records and your patient medical records, you do need to know that they are to be kept separately. They are not kept together. Your patient accounting software, what is that? It also means PMS, not premenstrual syndrome. I thought that was funny when I saw that. So PMS is patient accounting software. Okay, going further down and over, the pegboard system, towards the bottom of the page. What is the pegboard system? That is kind of being sorted out, all of you, because a lot of people, a lot of companies are going all electronically now to be more efficient. But the pegboard system is another tool that can be utilized. So just keep in mind, what is it and how is it used? Okay, I had you do, was your homework for today doing the, yes, doing the collection letter? Okay, okay. So what I wanted to point out on page 432 and 433, what I really wanted to focus on is the procedure 17.2 on 433. Okay, so we just talked about the PMS system, the practice management system. What I really want you to know and to memorize, not just for test purposes, but forever and a day, is your number one method. Log in with your username and password previously located. That will always be first, and you are the only one that will need, you cannot share that information. That information is private because you are going into patient financial billing information. So all of that is private. You are never to have this screen pulled up, this system, and leave your work area with your screen up, because patient information is on there. Maybe their social security number, their driver's license information, sometimes even their banking information, let alone with their insurance information. So that is very critical that you and only you have your username and password information. You will be, that is number one. So just keep that in mind and always remember that. So we're going to flip over now to 436. Your account receivable analysis. Your days in AR. Remember, AR stands for accounts receivable. So the days in the AR, what is it? It is the average number of days that money has been owed to the practice. It is calculated by dividing the total AR, which is account receivable, dollar amount, by the average daily revenue of the practice. So this is meaning that what is being able to be billed and what is paid. Your AR aging analysis in the next column. What does that stand for? What does that mean? It is a report. You do need to know what is on that report. And look at your days. There are time periods where this is before an account is getting ready to be sent to collections. So if you go to the doctor, go to the hospital, go to the emergency room, urgent care, whatever, they have days in their billing cycle that they have allowed before sending over a patient's account to a collection agency. So Medicare accounts over 30 days old should be investigated. That's the difference between Medicare and a commercial insurance like Blue Cross, Humana, any other private insurances. Nearly all accounts older than 60 days should be reviewed at least once a month so that the reason for non-payment can be identified and corrected. And whoever is doing the accounts receivable on patient billing needs to be contacting this patient either by mail or by phone call, and everything needs to be documented. So in the event that there is ever a lawsuit, there is records and there is documentation to support that they have tried every means necessary to contact this patient to get their bill paid. So going over to collecting patient payments. So on the second column at the top of the page, I am now on page 437. What information should the patients be given? So all of those things, charges for services, participating insurance plans, insurance billing practices, payment of deductible, accepted forms of payments, payment plans for those who don't have insurance. So patients should be given all of that information whenever they, have you ever gone to the hospital and you've had to initial here, initial here, initial here, initial here, and then sign at the bottom? That's what all of this is. And you are given that, and you have to then sign that you were given all of that. So it's like what's the word that I'm looking for? Duplication of work. So you're initialing, you're signing, and then the next page over, you're signing that you received it. It's kind of like the HIPAA. You have to even actually sign that you received the policy for their HIPAA privacy acts whenever you go to the doctor. All of this information should be kept at the reception area, and some physician offices even post this on their wall, like for example, payment due at time of service. This will be maybe posted on the window, maybe on the desk, or even the checkout desk. It may be even in the if they have like a triage area, it may be posted in there. So flipping over to page 438, professional fees. We've heard of physicians doing this, and they do this as a courtesy. Professional fees is determined by the physician or the practice that the physician works for. The prevailing fee is referred to by insurance companies as the customary fee when establishing a free schedule known as usual, customary, and reasonable, or UCR. You really don't see the abbreviation UCR used. It'll be worded out. Again, some medical offices display a sign that explains their fee policy. Collecting co-payments. What is a co-payment? A co-payment is the fixed amount that the patient's insurance policy may require them to pay for certain types of visits. And your patient should know this, especially if it's not a new insurance. They should know what their copay is. Some patients do not, and some patients even get angry or irate. Oh, I didn't know I had to pay that. And so you just really have to, you know, be very cautious of how you respond. And when you have a difficult patient like that, you can't just be sassy and say, oh, yes, you did. You can't say you didn't know your copayment, you know. So just be careful if you have to work when collecting money from patients, because, and sometimes it is a hardship, and we'll get into that. Sometimes when a patient goes to the doctor, it may be unforeseen. Let's say, for example, they're on a fixed income, they're on a fixed budget, and they get sick, and it's unexpected, and so they've got to go to the doctor. So that unexpected sickness, and they're going to the doctor, they're going to have to pay a copay. Well, they may not have the money because they've already paid their rent, they've already paid for their prescriptions for the month, they've already paid their utilities, their groceries. Again, they're on a fixed income. They really need to be seen You still see that patient even though they can't pay their copay? Not really. The emergency room is different. They are able to, and they have a sign at the emergency room. But if your patient comes to the physician and they're not able to pay their copay at the time of the visit, it's a high possibility they may be turned away because a copay cannot be billed to the patient. They have to pay something. They may make a payment arrangement. Let's say, for example, okay, your copay is $20 today. Well, I don't have that and I don't get paid until next week. What can you pay today? So be open-minded, see what your patient can pay and say, okay, well, I have to charge you the $20, but can you pay me $5 today? And then we will bill you for the rest. That may be feasible, but again, it's going to depend on your company's policy of what can be taken place. So we're going to go further on down. I just really want you to understand what a copayment is. And a little further down under the copayment collection, there is abbreviations, PPACA. That is the Patient Protection and Affordable Care Act. When that was heavily talked about a little while back, a few years ago. That is preventative care. So your insurance companies will pay 100% for all of their patients to have their preventative care, meaning annual breast mammograms after a certain age, annual physicals, annual wellness physicals. Your insurance companies will pay 100% if you are getting preventative measure care. As long as it's not to be diagnostic, your insurance will pay 100%. Managed care contracts. Second to the last paragraph down at the bottom. You do need to know what a managed care contract is. Managed care contract often require that the copayment be paid at the time of the visit and may not allow providers to bill patients at a later time. So accepting your copayments. Be courteous and professional when asking your patient for their copayment. Never be demanding for their money. You may have to have the office manager intervene if you have an angry patient regarding your copayment. On the next page, 439. What is internal control here at the top? What does that mean? Security precautions. All methods are accepted for payment, such as cash, checks, or debit cards. All forms of payment carry a small risk of being fraudulent, even cash. We have people that make money that are fake bills. They may have a stolen credit card. They may have a stolen identity. They may write you hot checks. So all of those forms of payments be a risk for fraudulent payment. What does NSF mean? NSF means that a check has bounced, meaning that the funds were not in the checking account when it was run. Collecting insurance payments on the you will see remittance advice RA statement, or also known as explanation of benefits, your EOB. Your EOB is going to be the explanation of benefits where you have gone to the doctor, hospital. If you've had a test done, you are going to be you receive these in the mail, and they are called explanation of benefits. And this is going to be that detail of what you were billed for, what they charge for insurance, and then the amount that you owe your provider. Have you ever had one of those and you know what they look like? It's a detailed list of everything. Yeah, got a huge stack of them in my dining room. So they get shredded probably once a year. But it is nice to compare whenever you get your EOB to your, I like them in the event, let's say, for example, when my husband went through chemo, I kept my EOBs. That way I could compare his explanation of benefits to our bill. That way I could see, okay, is this amount that I really owe you, or that what you are telling me that I owe you accurate? Okay. And your explanation of benefits as well. I have received one time where it was saying that my services were denied because, and it gives you the date of the procedure or the visit. Let's say it was sending me an EOB explaining that it was denied, and I called them to let them know that I didn't go that day. I don't know what it was for. Can you help me? And so I had immediately thought that maybe someone was trying to use maybe my insurance card or something. But it's really good to kind of get those, review them whenever you get them in the mail, and then either shred them or throw them away, burn them if you don't need them. So I was able to get that resolved because I opened it and looked at it, because I knew that I had no longer had that certain insurance. So just keep that in mind, that it's a detailed record of what's billed to the insurance and then what you owe the provider. That's what an EOB is. What is a bulk remittance? Down halfway down. Your bulk remittance helps to reduce on paperwork. It is a large insurance carrier. They may send, let's say, what this is meaning to the provider, they will send, let's say, for a week or a month worth of billing, rather than sending, let's say you see 50 patients a day. Well, if you see 50 patients a day for 5 days a week, that really adds up. That's going to be a lot of mail. So what they'll do, instead of sending each individual patient, that's paper, that is envelope, and that's postage. So what they'll do is they'll compile everything into like a format, and they'll mail it all like that. Okay. Or some to help cut down on all of the paperwork. And a lot of facilities are even doing that. So we're going to flip over to page 441. What is a reason code? Insurance carriers often use reason code or remarks code on your EOB to identify the reason for payment adjustments and denials. We're going to be getting into coding in our next chapter. It's going to be a difficult chapter, but we will get through it. And I promise you, I will make it as, I will have to do more videos with you or for you. They may not be live videos, but we're going to get through it. Even if I have to help, if I have to get YouTube to help me out a little bit with that, I may get Miss Marcia, the other Miss Marcia, medical billing and coding, to do a short video to help us out a little bit on that. But we're going to get through it. I'm certified in medical billing and coding. I've had to, whenever ICD-10 first came out, I was doing claims at long-term care facilities. So I had to sit through all of that training in 2015. So it was not fun by any means, but got through it, all the painful, the tears. And so it's, we're going to get there. And I'm going to give you the main points that you need to know. So rejected claim. So whenever it's just, you know, kind of, it is what it says it is, it's rejected. Whenever something is rejected, it comes back, right? 442, there's pictures of lots of forms. So I just kind of want to, I'm going to give you what's important on the pages to study for your test. So this is an example of an explanation of benefits, but you shook your head. Yeah, you had received one of those before. So I wanted to point out at the bottom of your page in the second column where it says adjustment, I think it's the second paragraph. An adjustment is a positive or a negative change to patient's account balance, such as correction, change, discount, or a write-off. And usually an adjustment is a positive notation. And sometimes it's really handy when those EOBs do come in. That's what I was saying, to compare, because sometimes, have you ever received a reimbursement from your insurance company or your doctor? Sometimes what they'll do is, I know that dentist office or mine do, they'll charge you 100%, let's say, for example, for an annual teeth cleaning. And what they'll do is they'll either put a credit on your account at the office, or they will receive you a reimbursement. And what that means is there's a certain amount that they have to charge you. And then let's say if you don't have a set copay amount and they bill for a percentage, once it is filed with the insurance company, and then the insurance company will say, you billed the patient too much for this service, so either you need to reimburse them or we will reimburse them. One of the two. Somebody's going to give you your money back. Either you'll get a credit on your service there, or get a $5 check in the mail. I mean, and they have to, even if it's just $5, they have to send it to you, because it's going to mess their books up if they don't. Okay, now I have gone to 446 under rejection, denials, and appeals. You always have that right as a patient or as a person to appeal anything. What you need to know about rejection, denial, and appeals is that they can be denied or rejected many times for errors that the medical office made. And some of the ways that the mistakes are made are by incorrect identification numbers, incorrect birthdays, missing diagnosis codes, missing supporting documentation, all delay payment of insurance claims. So it's very important that all of the information is correct whenever you're billing a patient. And there are reasons that they can be denied or rejected. What is a disallowance? What is the definition? Second column. When a provider is contracted with an insurance company, the disallowed by the insurer is the contractual allowance and must be written off. So insurance companies do say you're only allowed to bill $200 for tooth extraction, and you are charging the patient $300. Well, that balance between $200 and $300 has to be written off. So that means that the medical office is not getting paid for that. And they do have a certain amount that they can write off each year. All right, page 448. This was a big chapter, Christian, so bear with me. I may need to stop talking and just get right down to it, huh? So I can get off track very easy, but I can get back on track too, but sometimes I get too fast when I get back on track. Okay, so Dan, for billing cycle, there are two types of billing cycles. I actually gave y'all this on a question of the day. What is the difference between a monthly billing cycle and a cycle billing? So just know the difference between the two. Okay, what's the definition between monthly and what's the definition of cycle? To page 451. Cash discount. This is very big. This means that if a patient does not have health insurance, that the medical office can give a reasonable discount to patients who pay in full at the time of service, known as cash discount. And there'll be a certain percentage that they're able to tell that patient. And now that does need to be paid up front before the patient receives their care. Professional courtesy. Professional courtesy is the discount or fee reduction a physician opts to give other physicians, staff, family members, or clergy. This must be documented because if your billing doesn't match up, there needs to be a reason why. So if there is a professional courtesy reduction fee done, it does need to be documented, the reason. Financial hardship, what is that? It is the inability of the patient to pay. Okay, page 453. Collecting patient balances on your delinquent accounts at the bottom. You do need to know the reasons that a bill becomes delinquent may include all of those reasons. And then number one is the patient believes that the insurance will cover the bill. So sometimes the patient will only pay their copay at the time of visit, but not like if they get statements in the mail, they just may put them to the side and wait and wait and wait and wait and say, well, I'm going to wait and see what the insurance company pays on it before I make any payment. So that's the number one reason. 454, collection techniques. There are several methods of collection. Reminder notices, telephone calls, collection letters, and finally a collection agency may be used. Those and it's typically in that order. Phone calls, notices, letters, and they have so many days and then they'll turn it over to a collection agency. So with that being said, on 455, on collection agencies, there at the bottom, the last paragraph, physician should approve all accounts before being sent to a collection agency or being written off. Once a patient's account is in the hands of a collection agency, most offices will terminate the physician-patient relationship. Using for notification procedures as determined in the office manual. If your physician does decide to terminate or fire that patient, if you will, those are the terms usually used because of collection balance, your patient will need to be notified, and it's usually done by certified mail where someone has to physically sign for that notification. And all of that will need to be documented in that patient chart. And usually a copy of the letter will also be put on that patient chart. When you are selecting a collection agency, what are the ways deciding on choosing which agency you are going to use? You can do an interview, the Better Business Bureau. You can even ask other medical offices who they use. Let's see. On page 457, second paragraph. Most companies charge a percentage of the amount collected, called a contingency. Can range from 25 to 50%. So this is meaning that if an account has to be turned over to a collection agency, they are also going to charge fees, and it's to 50%. And the term that is called that is contingency. 58. What is skip tracing? What is a skip? Just know that definition. Down to claims against estates. When a patient dies, a bill must be sent to the estate of the deceased. Go back to page 457. Underneath in the first column, the first full paragraph where it says, be certain to include the only minimal necessary information when returning over an account for collection. You do need to know the information that you put on a collection letter, and do not, circle do not include a diagnosis or other medication. This is a violation of that patient's privacy. Okay, so you do need to remember that. So your test on chapter 17 will be tomorrow, and we will be doing a recap tomorrow, some fun things. It's going to be a fun day. So I don't know yet what we're going to, I've got some thoughts going on in my head of what we're going to do and how we're going to do it. And then we will start lecture on chapter 18 on Monday. I will go ahead and send you, I will post to Edmodo your PowerPoint slides for chapter 18. That way, if you want to start reading ahead, not chapter 18, I'm sorry. It's chapter 18 was next, and I just flipped to it. Chapter 15. Chapter 15 is next. It's diagnosis, medical coding, ICD-10. And I will to the campus tomorrow to get an ICD-10 book so that I can show you what it looks like, and we can, that way, next week when we get into lecture, I can point out certain things on the book for you to get into that. So I will go ahead and post those PowerPoint slides for you all. We will have a fun and a prosperous next couple of weeks. Hopefully the stay-at-home order will be lifted May the 15th, and we can return back to class on May the 18th. So I'm excited to see everyone. I know that everybody is waiting patiently, being able to get back into class. And we're missing the hands-on, but we're gonna get through this together. So, okay. Well, good luck everyone on your test tomorrow.